Those drugs specifically are carboplatin and cisplatin, and they are harder to come by because of expanded demand and issues with manufacturing overseas.
And patients here in Alabama are also being affected. ABC 3340's Valerie Bell spoke with the pharmacist at Alabama Cancer Care in Tuscaloosa to understand how doctors are ensuring patients get the treatment they need.
Amanda Poole is a clinical pharmacist at Alabama Cancer Care in Tuscaloosa. She says the shortage of two key drugs used for chemotherapy treatments is extremely concerning.
They say drug shortages can last up to a year and a half, which when you think about that and think about people's lives, especially when they have cancer, is very scary. That's a long time.
Since carboplatin and cisplatin are harder to come by,
Our distributor right now is allocating, which means they will allow our clinics to get 1 vial a week or 1 vial a day, or kind of whatever comes into them.
Since Alabama Cancer Care operates more than a dozen clinics in the state, allotments have been moved from one location to another.
So if a patient in Montgomery needs carboplatin tomorrow and my clinic in Anniston has it, we will get it to that patient.
But pharmacists have also been forced to look for alternatives. 2 patients here in Tuscaloosa have had their entire regimen changed completely.
Carboplatin and cisplatin are cheaper drugs. Insurances love them for that reason. And so we're having to fight with insurance companies, warning, saying, hey, we need this more expensive drug because we can't use these other two because they're not available.
While that substitute may be more expensive, it may also come with more or different side effects.
We've also had to be very conscientious to that and make sure the patients know, okay, we're changing your regimen because we can't get the drug. You're still going to have the standard of care that you would with the other ones. But if you start to feel worse or if you have any side effects that you didn't have with the carboplatin or cisplatin, let us know and we'll evaluate that and take care of it as needed.
In Tuscaloosa, Valerie Bell, ABC 3340 News.
The American Cancer Society Cancer Action Network urges Congress to look at longer-term solutions that change the fundamental underpinnings of the shortages. For now, the network wants the industry to work with medical practitioners to identify alternatives so cancer patients' treatments are not delayed.